Hello, everyone. I'm Richard Levin, the President and CEO of the Arnold P. Gold Foundation. I want to greet all of you who are starting your nursing careers or the clinical rotations in your nursing school and congratulate you on your courage in this time of COVID. In the Year of the Nurse, the 200th anniversary of the birth of Florence Nightingale. And I'd like to give a warm welcome to your family and friends, to your faculty and your deans. Amid a global pandemic, during a devastating economic crisis, and at a moment of reckoning with terrible and persistent racial inequities, it would have been easy to cancel this ceremony. But humanism is not canceled. In fact, the world can see it now more clearly than ever. In times of crisis, healthcare swings into a different mode and reveals itself for what it truly is, one human being caring for another. The White Coat Ceremony was created in 1993 by the Arnold P. Gold Foundation to mark this moment in your journey as clinician, to recognize your awesome responsibility to the patient in front of you, and to emphasize the importance of compassion, respect, empathy, and ethical patient care. In 2020, this ritual has even more meaning. In moments of difficulty and challenge, you can reflect back on your ceremony today and remember again why you first decided to become a nurse: to help people to heal, to care with compassion, to make the world a better place. Thank you so much for this contribution.
As we celebrate your White Coat ceremony, I'm pleased to introduce the Honorable Lauren Underwood to present the keynote address. Representative Underwood serves Illinois' 14th district as the newest nurse elected to Congress. She is the first woman, the first person of color, and the first millennial to represent her community. She is the youngest African-American woman to ever serve in the United States House of Representatives. Prior to her election, Congresswoman Underwood served as a senior advisor at the United States Department of Health and Human Services, working to help implement the Affordable Care Act, as well as prevent, prepare for, and respond to disasters, bioterror threats, and public health emergencies. Representative Underwood is also a former AACN intern who, as a graduate student at Johns Hopkins University, expressed a strong desire to serve in Congress someday. In less than 10 years, she has made that dream a reality. Representative Underwood is a strong, steadfast champion of nurses and the nation. She is a vibrant voice for compassion and humanism in healthcare, which is the heart of this ceremony and your work as future nurses. We are proud to have the Congresswoman join us for this momentous occasion and serve as an inspiration as you take your first steps to becoming a nurse. Congratulations, and please welcome Congresswoman Lauren Underwood.
Hi, everybody. I'm Lauren Underwood. I represent Illinois' 14th Congressional District, and I'm a proud nurse. Thank you for the honor of addressing you on the day of this critical milestone. I'm so glad to be able to celebrate with you. I'd like to thank the American Association of Colleges of Nursing and the Arnold P. Gold Foundation for coordinating this virtual ceremony and providing an opportunity for all of us to reflect on what brought you to this point in your professional formation. I completed my BSN at the University of Michigan, and it doesn't seem like that long ago that I completed my MSN MPH at the Johns Hopkins School of Nursing. I started at Hopkins at the age of 21, the youngest member of my class. I was ambitious, excited, and ready to chase after opportunities with an open heart and mind. I started my master's program in the summer of 2008, just months before the onset of the Great Recession. I was living a block away from my school in an unfamiliar, low-income African-American community. The rapid economic downturn illuminated the poverty in the East Baltimore community I was living in and the inequality in our nation's healthcare system. The recession also accelerated the urgent sense of purpose I felt to pursue my work on health disparities. I quickly accepted a job as a research fellow at the National Institutes of Health Clinical Center, where I worked with nurse researchers to better understand clinical trial participation among minority patients in an effort to tackle that long-standing equity issue. I later worked as a research nurse on another health disparities study. And in my coursework, I focused on improving African American birth outcomes, examining infant mortality and preterm birth rates, and evaluating policy interventions like expanding Medicaid and funding nursing education. It was little more than a decade ago, in 2009, when I graduated from Hopkins. At the time, more than 40 million Americans lacked health insurance, and I saw a transformative opportunity in the Affordable Care Act to increase access to care and improve the health of the American people. I'm so grateful I had a chance to work on the Affordable Care Act implementation in the Obama administration after graduation. My commitment to ending disparities in maternal-child health outcomes continued in the administration, where I later worked to advance equity with the White House Council for Women and Girls. As I was serving out the last few days of the Obama administration, a classmate and good friend of mine from my MSN MPH program, Shalon Irving, gave birth to her beautiful daughter, Soleil. Just 3 weeks later, Shalon collapsed and passed away due to complications from high blood pressure related to her pregnancy. She was just 36 years old. Shalon was an epidemiologist at the Centers for Disease Control and Prevention, where she worked to investigate and eliminate health disparities. She was highly educated with a doctorate. She was excited to be a mom, and she had done everything right, and we still lost her. I couldn't believe it. Her death was a devastating reminder of the disparities that women of color face in our healthcare system. The statistics are unacceptable. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women, and more than twice as likely than women of other races. Maternal health outcomes, which have been improving worldwide, have worsened over the course of my lifetime in America. Here, right here, in the United States of America, the richest country in the world. Looking back, I can see it was my training as a nurse and in public health that gave me the grounding and evidence-based decision-making that's not only essential to nursing, but to policymaking. That foundation and Shalon's story, which I carry with me every day in Congress, inspired me to co-found the Black Maternal Health Caucus to take on these disparities through evidence-based policies. It's why in March of 2020, I introduced bipartisan legislation to take urgent action to address our nation's maternal health crisis and to finally end the racial disparities in maternal outcomes. And I'm proud to say more than 100 members of Congress have joined me in this effort. Don't ever doubt that change is possible. My training as a nurse provided me with the data-based grounding that has been central to my work in Congress. But being a nurse is even bigger than the practical knowledge you learn and the skills you employ. Fundamentally, nursing is about the intimate moments that you'll have with your patients and their families at the bedside, answering their questions and addressing their fears in what might be the most difficult moments of their lives. That's what white coat ceremonies are all about. The traditions of compassion and patient-centered care that have deep roots in the nursing profession. I've carried this spirit of compassion with me during my time in Congress. In fact, some of the conversations I have with constituents aren't too different from the ones you'll have with your patients. People so often come to me when they don't know where else to turn. Whether it's an issue with getting their Social Security payments or challenges paying off their student loan debt, or an inability to afford insulin for their child with diabetes, in just a few short minutes, you can share in the struggles of members of your community and work to develop policies to help them. My hope for you as you begin your careers is that the spirit of compassion and service that drew you into nursing will stay with you and carry you through the hard days. And as our nation has seen through this pandemic, there will undoubtedly be hard days. But your passion for helping others, particularly the most vulnerable, is a light that will help you see in the dark. And when days are long and you feel tired or sad or worn out, remember that there are patients who look at you as their reason for hope. Also remember to take care of yourselves and look out for your fellow nurses on the front lines. When so many others depend on you, it's especially important that you're getting the support that you need. Because let's face it, our nation can't afford to lose you. not only for the clinical expertise that you'll display every day with patients, but in the wide range of ways that you'll be able to be change agents in your communities. Nurses are making a difference as clinicians, researchers, policy advocates, faculty members, and yes, even as members of Congress. Whether you'll be making breakthrough scientific discoveries or leading an advocacy campaign to push for access to affordable health care, your nursing background will prepare you for a career dedicated to promoting the health and well-being of your neighbors and our nation. You might be remembered by a mom as the person who saved her son's life, or a dad who watched his daughter's face light up every time you walked into her hospital room. You might be remembered by the elderly patient who doesn't receive visitors but knows you as a friend. You might be remembered for the important paper you published in an academic journal that advances our understanding of the impacts of air pollution on childhood asthma. Or you could be remembered for inspiring your colleagues to call their representatives and express support for legislation that will provide necessary funding for nursing schools. There are so many possibilities ahead of you, but one common thread runs through them all: the opportunity to make people's lives better. There's no higher calling. So, as you prepare to do this critically important work, I hope you're feeling inspired and excited. You might feel a little nervous too, especially in the midst of COVID-19. But as nurses are desperately needed on the front lines of this public health crisis, you will continue to be needed long after the pandemic. There are urgent challenges that must be confronted, from the disparities that exist throughout our healthcare system to the unacceptable barrier of costly, unaffordable care that hurts millions of Americans every year. There's a lot of work ahead, but for now, I hope you can celebrate this exciting milestone. Know that your families, friends, and classmates and faculty will be there for you every step of this journey. I'm so proud of you, and I can't wait to see you change the world. Congratulations, and remember to take good care of yourselves.
Dear students, now that you have participated in the white coat ceremony, this portion of the ceremony is reserved for the completion of the Honor Code Pledge. We proudly display this pledge along our hallways at the UWF School of Nursing, where it serves as a daily reminder of our commitment to providing care with a holistic, kind, compassionate, humanistic approach, and we remember to include ethical standards first and foremost in our care. Let's take time now to recite this pledge together. You will find it on the back of your program provided for the ceremony. I join my fellow nursing students today to pledge my commitment to the highest ideal and academic standards of the education at the UWF School of Nursing. This commitment arises from the principles of honesty, integrity, accountability, confidentiality, social responsibility, and professionalism in all my written work, spoken words, actions, and interactions with patients, families, peers, faculty, and society as a whole. I pledge to exercise sound professional judgment while abiding by legal and ethical requirements, and I acknowledge my responsibility to report unethical behavior. I pledge to consider the welfare of humanity and relief of suffering my primary concerns, and I will act in a compassionate and trustworthy manner in all aspects of my profession. I pledge to work with and support my peers in the pursuit of excellence in our nursing education. I accept the lifelong obligation to improve my professional knowledge and competence. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily, with full realization of the responsibility entrusted to me by the public. Today, as I begin my nursing education, I accept the responsibilities and unique privileges of the nursing profession, and I pledge to uphold the spirit and letter of this code during my time at UWF and throughout my professional career as a registered nurse. Students, on behalf of the faculty, congratulations on making this commitment.